A very good morning to the esteemed faculty and colleagues on behalf of the Department of Ophthalmology GMCH. I heartily welcome all the dignitaries and budding eye specialists of Chandigarh and the surrounding states to the inaugural function of the 13th Ophthalmology Postgraduate Teaching Program as a part of AIOS Prayogshala under the aegis of Chandigarh Ophthalmological Society. I request Professor Suresh Kumar to kindly accompany our chief guest and other dignitaries to the dais. I would like to request Dr. Arshita to kindly welcome our esteemed chief guest, Professor Amod Gupta, sir. Now I request Dr. Vidushi to please welcome our worthy Director Principal, Professor Ashok Attri, sir. May I now request Dr. Arushi to kindly welcome Professor Sunandan, sir, our former Head of Department of Ophthalmology. Our department has been organizing the postgraduate teaching program every year, and this is the 13th event of the continued postgraduate teaching experience for the budding eye specialists of all the North Zone colleges. The program intends to give a platform to the upcoming ophthalmologists to discuss the important and relevant topics in this field, along with a unique opportunity to interact with all the experts in this field. Now I request all the dignitaries to kindly come forward for the lamp lighting ceremony. Now I would like to invite Professor Suresh Kumar, Head of Department of Ophthalmology, to deliver the welcome address.
Very good morning to all. Professor Amod Gupta, former Dean and ex-Chief of Advanced Eye Center PGI and Chief Guest of the Day. Professor A.K. Attri, our worthy Director Principal and Guest of Honor for today's function. Professor Sunandan Sood, our former Head of Department, and all the faculty of GMCH and department, as well as from Advanced Eye Center and other centers in Chandigarh, and all the students from various medical colleges in North Zone, students of my department and staff, dear friends. It's my profound privilege today to welcome all of you to our 13th PG teaching program, and my special welcome to Professor Amod Gupta for accepting our invitation and gracing this occasion as chief guest, and also my special welcome to all the students who have come from different cities in North Zone to participate in this program. And apart from North Zone, we are getting students from Rajasthan, Jaipur, Ajmer and Bikaner. And this time the students have come from KGMC, Lucknow also. So I extend warm welcome to all of them. This program in fact started around 12 years ago, and initially it started as AGV wet lab and trabeculectomy wet lab, which later on expanded to involve all subspecialties of ophthalmology. And credit for this goes to Professor Sunandan Sood, our former head of department, And it was his open approach, and he gave freedom to all faculty members in the department to pursue their area of interest and develop it. So whenever I went to him regarding organization of any program, he fully supported it. And then with the involvement all the faculty in the department, we gradually developed this program. And basic purpose was to prepare a program which lots of hands-on wet labs and a budget program which is exclusively for the students. So what was happening in big international national conferences, students normally don't get free access to the wet labs, and in the scientific programs also they are last in the queue, and it's very, very expensive. You have to spend a lot of money. So keeping all this in mind, we designed this program, and with support from all HOD of medical ophthalmology department, various medical colleges in the north zone, because they are sending their student every year, and with their support we are able to organize and continue this program. And to make it more budget, we always try to make arrangement for stay of the students in guest houses, and the registration is very nominal, 500 to 1000. So and this year we have lot of wet lab, and the current trend is to keep more and more hands-on training programs, and we have around 5 to 6 wet labs. Wet lab on Fekoshala today it's going on. It's Fekoshala is by J&J company. It's on phacoemulsification on wax size. And then we had wet labs on AGV implant, trabeculectomy and suture techniques on goat size. And we also had phakic IOL wet labs yesterday. And in dry wet labs we had refraction, contact lens, low vision aids, and then indirect ophthalmoscopy, and one more wet lab that was on low vision, lasers. Yes, it was quite successful. And what we do basically to make it more accurate or effective, we always make a WhatsApp group, and all the head of departments, they send their contact number of the residents who are participating in the program, and we make a WhatsApp group, and we take priority of the resident. We always put a message that these wet labs are available, and all the residents are requested to give the priority of the wet labs. And by the time they come to us, we already know how many residents want what wet lab, and then we, on the day, we send a message to the resident that your wet lab, next wet lab is this, so that the sessions can continue without much interruptions. So, and I had full support from my departmental faculty as well as Advanced Eye Center and from various centers in Chandigarh, because if you want to have a budget program, you can't invite faculty from outside. Then their travel expenses, stay expenses, they raise the expenses of the your program. And basically we are lucky that we are sitting in Chandigarh. We have a lot of faculty, and we don't need much support from outside faculty. And again, without the support from the departmental faculty and resident, you can't organize any program. And I am lucky that way that my department is fully supporting me in this program every year. And with this brief introduction, I once again welcome all of you and wish this program a big success. And we'll also like to have your feedback so that we can improve the program next time. Thank you so much.
Now I would request our former head of department, Professor Sunandan sir, to please grace the gathering with a few words.
Professor Amod, former chief of the Advanced Eye Center, PGI, in fact the architect of Advanced Center of PGI. Our worthy director, principal, Professor A.K. Atri, Professor Suresh, the HOD of the department, and my dear friends. I'm really delighted to be invited here in this PG teaching program, which Professor Suresh has just told that it is 13th teaching program which is being held every year. I highly appreciate Professor Suresh and his team that they are regularly, yearly organizing this PGTG program. And in my time, it was a very simple affair. But then, with his untiring effort and the cooperation of the faculty, this has become a bigger event. As he has already briefed that there are wet labs in almost all the specialties: refraction, low vision aid, lasers, glaucoma drainage devices, and even on goat's eye like continuous curvilinear capsular access and phaco, he was saying, intraocular contact lenses, he was talking. One thing which I want to highlight here in these wet labs is that the refraction wet lab is probably more important, because others you will positively learn in due course of time. In my time also, because of the paucity of the junior residents at that time, we had an intake of only 2 students. And when I superannuated, there were only 3 students. And so in all, 9 JRs. And then there is an addition of optometrist in all the departments. And I was lucky when I was postgraduate, we used to be posted in retinoscopy or in refraction chamber very regularly. Until I was associate professor in Rohtak, I used to perform retinoscopy and refraction, and that is paying me very well now when I'm in private setup. I have become a good refractionist also. So this is the area where I feel Professor Suresh and other HODs of the various departments, they should think over that how to make proficient our residents in the field of refraction. Your learning is such a thing which has to be a part and parcel of all of us. And we should learn with our open eyes and ears. And there's a quote also that if our mind knows something, only then the eyes see. And for learning, 2 aspects, theoretical and practical, or surgical in our specialty. The learning by theoretical is we know by net these days, or the best friends are our textbooks. But then it is not easy to acquire surgical skills. And this is here these wet labs are going to help our budding ophthalmologists, and various wet labs which Professor Suresh has just enumerated. You see, there is another modality also by which the students can learn, and that is simulators. I have seen simulator in Advanced Eye Center. These are available only in the premier institutions like Advanced Eye Center or in RP Center. I also tried to buy a simulator for my department, but then 15 years back, it was very cost prohibitive, about 35 lakhs of rupees. And the then boss of our institution, our director, he rather dissociated me. Dr. Sood, invest money in more basic and essential equipment than in simulator. We have a very vast population, vast majority, vast material. Students will learn from our lot of material which is available in our country. Now these days the trend is changing. You see, there are net available, Google Devta is available to us, YouTube is available to us, various videos have been uploaded by our surgeons for the guidance of our not only budding ophthalmologists, even persons like me also. Sometime you see we have to see the videos on the YouTube and learn the various surgical techniques. But then in addition, in our specialty, there is one advantage. And that advantage is that we organize camps and then we select the cases. We bring them to the headquarter operation theatre, well-equipped operation theatre, and they are being operated by our residents, senior residents, under the watchful eyes of the consultants. This is how we can sharpen the surgical, you see, the skills of our students. But there is some difference. if I go back about 40 years plus back, when I was a postgraduate in 1982, there used to be a Guru Shishya Parampara. And that was to be there because there was nothing else than Guru Shishya. Because they used to be our sole torch bearers in our careers. Surgical skills, we have to learn from them. There never used to be, at least I don't remember in those days, there used to be wet labs. There is no net or no Google Devta. You have to learn from your teachers. But then these days, it's in a modern era. These days, I would say that this Guru Shishya Parampara is slightly fading. It is not that charm, and not having that charm. That shloka of Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Parbrahma, Tasmai Shri Guruve Namaha, that is probably receding these days. But then I suggest all my colleagues, my teacher colleagues, that yes, we need to have a proactive, enthusiastic approach these days so that we can make our budding postgraduates to learn surgical techniques and take the credit that otherwise also they will learn surgery. Nobody can stop them, those who are interested in learning surgeries. But as teachers, we should take the credit, yes, Dr. Sood has made me learn this surgical skill, even in this modern era. Before I finish, I would like to suggest the students also that there are so many satsangs going on, jhute or sache, but there is one satsang what I feel is a academic satsang. That is, the students should be in the company of knowledgeable senior residents, learned teachers. This is called academic satsang. I myself used to be in the company of Professor Amod himself and Professor M.R. Dogra in various conferences as co-examiners, wherever possible, used to sit by his side so that maybe I can learn still more, update myself. And the last thing which I would like to add is that, you see, there is one term which I have coined. Those who are working with me, associated with me, I used to tell them that yes, you should become chipku. You should stick around. You should become chipku to the books, chipku to your teachers, and lastly, you should become chipku to the most important patients. If you are chipku of all these three, nobody can stop you from becoming a very good doctor. So, I suggest that you should follow this dictum. You should become chipku. You should stick around all these so that you become good doctors. With these words, I once again thank Professor Suresh has given me this opportunity to share my thoughts with all of you. Thank you so much.
Thank you, sir. May I now request our worthy Director Principal and Guest of Honor, Professor Ashok Khatri, sir, to please introduce our Chief Guest of the day.
Good morning to all. It's my honor to introduce my teacher, Professor Amod Gupta. You must be wondering why I am referring him to as teacher. When I was doing my junior residency in PGI, he was one of the very known figure in the field of eye, and I consider everyone who was directly or indirectly associated with my training and then senior residency in PGI as my teacher. So in that sense, and beyond that, I learned quite a few things from him, because what Professor Sunandan Sood was telling, that your personality develops when you keep on observing your senior and colleagues, how they are conducting. You assess a person on different parameters and try to imbibe so many things directly or indirectly. It's not always important that I should have been studying in Department of Ophthalmology in PGI to get a few things which were very good in the personality of Professor Amod Gupta. I think introducing him is a very difficult task. First and foremost, introduction of him is a very good human being. And that is, I think, that should be the best introduction for any person. Beyond that, all these other day also I told, we carry on labels with us. Today I am director principal, then I will become former director principal. Till April 1st I was former head of the department of surgery, then I voluntarily handed it over to my next, so I became former head of the department. And then a time will come that we will definitely be, going into some oblivion. But it is customary to introduce the achievements of Professor Amod Gupta, and this is important because the people who are going to emulate him in their life, they should try to attain all those things which he has achieved. When I was junior resident in PGI, he was not head of the department of ophthalmology that time. But subsequently, when he took over, I think Advanced Eye Center was the second advanced center to come after Advanced Pediatric Center. And today, if you go to APC, I had been invited twice for some program there. It stands as an institute inside the institute. And you all who are not part of PGI establishment must visit this center once to see how a visionary can develop this such a big thing. Professor Amod Gupta is one of the very decorated person in the field of ophthalmology and medical sciences in general. For his this exemplary achievements and the contribution to the field of ophthalmology, he was awarded the 4th highest civilian award of the country in 2014, Padma Shri. Beside this, if I keep on reading his achievements, it will be very long. But his work as a researcher has contributed a lot in the field of ophthalmology. I think tuberculosis of eye, I cannot specifically say which part because that I will be transgressing my, I think he is word authority on that. Some time back we met on the airport, he was going there and I just mentioned about it. And he said that even today he is getting emails from different part of the world. And he tried to answer us about the queries about the tuberculosis because in other countries, advanced countries, this entity is almost unheard of. So he virtually is authority on that, and by that he has saved so many eyes. Another point which is a very good, sir, I will miss quite a few achievements of yours. I will not read them out. But he is the rare example where he said that I will not practice once I superannuate. Okay, so someday I didn't ask him directly because I didn't have courage to ask that, but somebody told that he said, I don't want to give competition to my juniors or contemporaries. That doesn't mean that Dr. Sood is giving competition. So it is your own personal choice. I did ask on the airport, how do you spend the time? He said gardening is one of his hobby, which mine is also. I have few years more to go to retire or superannuate. I don't know what I will do, but as of now, I have the same philosophy as of Professor Amod Gupta. We have done enough. We are going to do enough till the time. But what I think, which Professor Amod Gupta may not agree to, that once you achieve something in your field, you become master by the time you superannuate. Superannuation doesn't mean that person has to be discarded now. And the person should also not feel that now I am not worth giving anything to the society. Rather, at this stage, we can contribute a lot by associating with different organizations, giving your expertise to that. For last 6-7 years, I also adopted one technique. I have done almost 2,500 surgeries only for that. I left the rest of the general surgical procedure or GI surgery procedures to my colleagues in the department. Laparoscopy also I left long time back to give chance to the younger generation to excel. But field which I chose, I personally think that the way I superannuate, I probably will continue with that, because that is one of the difficult thing to operate, and the recurrence rate is very high in fistula and nano. And I devised my own methods in that by using Kshar Sutra, combining Ayurvedic technique with the allopathic. So I don't know, sir, you will be very much there once I superannuate what decision I will take. But we admire you all, for your all the achievements, and for all as a good human being, always as a coming to a little bit about PG teaching program. Every organization has now devised their program. We have a surgery update in MAMC every year, which is very largely attended. I am telling you, this time also there were about 600 residents, registered residents. 7 days program, 6 days program it is, starts from Monday to Saturday. And then they call faculty from all over India or sometime from abroad. But what unique is in your program is the hands-on training. सर्जिकल रेजिडेंट्स जब भी ट्रेनिंग कर रहे होते हैं ना, दे ऑलवेज कर्स देयर सीनियर, चाहे सीनियर रेजिडेंट हो चाहे फैकल्टी हो, क्योंकि उनको मौका नहीं मिलता सर्जरी करने का. बट GMCH हैज़ ए डिफरेंट फिलासफी. PGI में तो ऐसा नहीं था. एज ए JR मेरे को हार्डली 1 या 2 सर्जरी किसी सीनियर रेजिडेंट ने कराई थी, विद लॉट ऑफ ऑब्लिगेशन ऑन मी करवाई है. तो यहाँ पे ये वाला आइडिया जो है, इसके लिए आई विल कॉन्ग्रेचुलेट Department of Ophthalmology. Professor Sood started it, Dr. Arya continued it, now Dr. Suresh is continuing. So best wishes, learn with heart, everything. At the end of the day, I always say, whatever field you choose, you have to come in top 5% to become relevant, to be recognized in the field, or in any subject for that matter. Even if you take history, you have to come in top 5%. That doesn't mean that 95% will not be doing good. They may be doing good in a different way. But if you have to become like Professor Amod Gupta, then you have to in top 1%. Thank you.
Thank you, sir. May I now invite our esteemed chief guest, Professor Amod Gupta, sir, to please address the audience.
Well, thank you, Professor Atri, for that introduction. And just a minor correction, I lost my interest in gardening, but continue to maintain my interest in academic, online and offline, and lecturing around. And I just finished this year a book which is gaining a lot of traction world over. And congratulations are due for Professor Suresh Gupta and Sunandan Sood for starting this very nice program. And that brings me to a little sensitive subject. And as he said, you represent, and I'm sure there are a lot of senior faculty members sitting here, but primarily I am kind of going to touch upon the students present here, the residents in ophthalmology. And I'm sure all of you have undergone the UG NEET and then the PG NEET to gain a seat, which is a fairly homogeneous, fairly serious, entrance into a medical school and specialized course. But we have now 700 plus medical colleges in this country, and which are churning out about 100,000 plus physicians every year. Half of them specialists, or maybe a little more than half of them specialist and super specialist. Yet what we find, to a major disappointment, there's a huge heterogeneity in the products that come out of these medical colleges and specialty programs in this country. Why is that heterogeneity? Have you ever thought of that? I mean, is there any need for Suresh Gupta to organize these kind of programs, and some of you having to travel from Ajmer, Jaipur, Bikaner and Lucknow to attend these kind of refresher courses? Now we as teachers, and I'm going to be talking more about teachers and the students, we have always been evaluating you. We have been always being judgmental. You know, you fail, you pass, you are bad, you are a good student, you are a bad student. Professor Atri just mentioned that you got to be in top 1% or top 5% of the students. Now cross your heart and ask yourself, have you evaluated your teachers sometime? Anybody? Have you ever assessed them? Now this is what I'm talking the world over. The students across the world in major universities of the world, which rank very high in the hierarchy, you know. The teachers do so well, the learning environment is so good, and they churn out the best people because the students evaluate the course, they evaluate the teachers, and they are the ones who are keeping the teachers on toes all the time. I'm sure in your own mind you know who are good teachers, who are bad teachers, who are dominant teachers, who are kind of acidic teachers, toxic teachers, who are good, who are bad. You don't have to do a study. You know instinctively he's a good teacher because you learned a lot. Or you say somebody is a poor teacher because you didn't learn much. And I have had, you know, almost now more than 50 years experience when I joined PGI as a postgraduate, and have almost like now 56 years experience of seeing teachers of all color shade, good, bad, indifferent, and possibly the worst ever. Okay, I don't know whether the teachers have changed. Till some years ago, till I superannuated, they had not. They remained the same. Now, anybody know the significance of this date, 4th September 1998? And I'm asking here the residents present. You know, there is a myth, and there are universities across the world who have on their campus a fountain and a god sitting there, the goddess of wisdom. Okay, and it is a fountain, the water flows down that fountain. Okay, because we all believed the teachers, they were fountains of knowledge. You are sitting at Guru Shishya Parampara. You are sitting at the feet of the teacher, and it's up to him whether he wants to impart you any complete knowledge, he wants to give you a very selective knowledge, or he keeps it, you know, tight-fisted. And I've had first-hand experience of that, because some of our teachers would be able to attend international meetings, conferences. They would gain some knowledge. Okay, this is how it is done, this is what the new drug is, this is what the new procedure is. They would be sitting tight-fisted on that. They would not share. Why? The fear. Somebody mentioned, you know, this guy, small little fellow, chirrup fellow, he will start competing with me tomorrow. This date changed it all. It's the watershed in history. 4th September 1998. Do you know? Have you heard of, now I'm giving you another clue. I like people to be live and reacting. Larry Page, Sergey Brin, have you heard of these people? Anyone? Just shout it out. Somebody said that. Absolutely right. And what were they? They had gone to one of the best universities, Stanford, They were PhD students. One came from Russia, one was an American. Okay. And they quit. They founded, and they, the Google, the search engine was launched in USA, and I'm sure most of you residents are the products of after that date, if I'm not wrong. Huh? Is there anybody in this hall except the teachers or senior people here who were born before that? So we saw the transformation. The internet was already there, and we had some experience of that internet from around that time. But Google had not really arrived in India for a couple of years after that. So what was the conventional role of teachers? Teachers were providing us information. And somebody who had more information, he became a teacher. You had less information, so you became a taught. Now when the Google came, the teachers suddenly became irrelevant. Those teachers who were just transmitting information or transmitters of knowledge, they became irrelevant, because even in the classroom when you are sitting, you have your smartphone, you have your notebooks, you have, teacher is trying to tell you something, the diameter of cornea or the length of the eyeball, and here the student sitting there and said, no sir, this is wrong, what you're teaching is wrong. This is exactly this information. So you carried all the information that is required in the world in your pocket. Okay. And probably you had access to more information than your teachers had. So they became irrelevant. Students stopped going to, there was a phase, students stopped going to classrooms. They said, this fellow is teaching me anatomy, I can Google it. Okay, it became a generic for all the search engines and artificial intelligence that came over the years, which has followed. So you have access to that information if you have an internet. So when I'm told by some of the people sitting in rural dispensaries, we don't know, we don't have access. Arey bhai, you have access. If you have a smartphone, and I'm sure the entire country, the entire world is networked, there's hardly any area where you don't have a network and you don't have a smartphone. So you have access to that information. But does it make you a good? So you don't know how to apply that. You might be able to internalize, convert that information into knowledge. Unless you do that, it's useless. But how do you learn the application of that knowledge? Particularly in reference to the field of medicine, that you may know that for fever you need to give ABC antibiotic. But if you don't know the context in which that treatment has to be given, you don't know how to apply your knowledge appropriately. And I'm not carrying my presentation here, I would have shown the disasters that happen, because if you have half knowledge, which I always say, half knowledge is worse than having no knowledge at all. So because you don't know the application. So your teachers are still relevant in medicine. As somebody has told, you need to, learn the clinical skills, which will not come by reading the books. It will come by being with your teacher in the classroom and in the clinic. Okay, and so is the surgical skills, which are going to. But more importantly, you will learn how to apply, because the teacher has done it, seen it, and seen the consequences of that. So he knows that if I give this a particular treatment, this is going to fail. This will end up in disaster. This one works. So he is transmitting all his wisdom that he has accrued over the years. Now, is that enough? Is that enough? It's not enough. Because as I said, the products that come out, and we are seriously short of, good empathetic physicians, we are short of medical teachers, we are short of teachers, we are short of researchers, We don't have, sorry to say, 700 plus medical schools don't come out with any good quality research or any path breaking work that emerges out of India. Why is it that? Because you as students don't ask questions. Because you have been snubbed whenever you try to, right from your childhood to your college days and medical school and post graduation, you don't ask any questions. You are not curious. So that has been systematically in the last 100 years has been killed. You are not able to freely communicate with your teachers. I'll just give you an example. I hope you heard of the name William Osler. Anybody heard? No? No? You don't know who was William Osler? He was the founder of the Johns Hopkins Hospital in US, in Baltimore. He was also the father of the modern bedside medicine that we practice. Okay. And he would have his students walk into his home every weekend, Saturday, for just conversations. He would just chit chat over supper. That was his style. Because that was a tradition we lost somewhere, where teachers, the students felt comfortable visiting the teachers, sitting with them, chit chatting not about medicine, but everything else. So he told them stories of medicine. He was he had a huge library. He had gone around the world, and he had so many stories to tell about medicine. And his students wanted to do more, learn more. So he whetted their curiosity. That was his way. You heard of this fellow, what's his name? Anyway, the neurosurgeon, the first person who did the first surgery on the brain, Harvey Cushing. Heard Cushing? No? Even Harvey Cushing you don't know? He was a father of the modern day neurosurgery. He was working with William Osler for almost 15-20 years in the Johns Hopkins. Physician communicating with a neurosurgeon, all the time sending his patients for advice, sending to his student or his junior, very, very junior colleague. And he in turn, discussing across. We didn't have email those days, so there were people who were writing, like Mayo, the founder, William Mayo, the founder of Mayo Clinic. He was very fond of Harvey Cushing, who was working in a competitive organization, the Johns Hopkins Hospital. And he was so interested, he said he would communicate, he would send cases. Okay, this is the case I saw, and what are your comments? And this fellow would send across to him, okay, what are your comments? So exchange letters. These have been documented as part of history of medicine. Correspondence between all these people, and that is how they went on to found new subdisciplines and disciplines, and they became what they became. Just by developing a level of communication with each other. I'm sorry to say, in my own experience, if I entered a room or if I was passing by, the students would turn his face. They would walk away. So I don't know where that fear comes from. So we have to break that. Unless we breach that fear of communicating, I think So these days, we are coming back a full circle after more than 100 years. And instead of teachers, we are transitioning into what is called mentors. You might have heard the word mentor. So I don't have time actually. Suresh would be, cursing me for taking so much time. But I don't want to be telling you. Find out for yourself where did this mentor word came around. It's a very, very short term. We had kind of mentors, as Dr. Sood mentioned, Guru Shishya Parampara, but it's coming back after 100 years, ever since teachers, transmitters of information became irrelevant thanks to the Google and now the artificial intelligence, and now you have a whole lot of YouTubes and you become much smarter. Okay, so what you need? We need in this country original thinkers, original researchers. We need people who are empathetic surgeons, empathetic physicians. We need the top of the line, physicians. How do you become that? Who will hold your hand? Who will lead you the path of excellence? Your mentors, with whom you can share your concerns, your fears, and he will tell you. So you need to be able to choose. When you go back home, just see which teacher fits the bill, who's available, who's excellent, who's not competing with his juniors, because that would invite disaster. If I'm the mentor and I'm mentoring someone, okay, if I start competing with my mentee, as we are called, it'll end up as a disaster. Okay, one who's available, one who is ready to mentor you, one who's already an accomplished person, the most important role, and I'll give you an example, if you don't go and quote me outside this hall. I remember almost like 40 years ago, director of National Institute, Bethesda. I'm sure you have heard of National Institute. This is the top research institute of the world. His director, Karl Kupfer, was standing next to one of very senior professors. And I came there. My professor turned his face to this side. I waited for a few minutes. I was a junior faculty member. I thought this guy is going to introduce me to Karl Kupfer. He did not. He was an excellent teacher. I became what I became because of his teaching skills, his exemplary behavior. But he was not a mentor. He was not a mentor in the true sense of the word. Because mentor does is, he will also, just like a coach, they will take you to the arena for boxing or for badminton or tennis. They need coaches to guide you, to hold your hand. When you are low, they will, give you a pep talk. They will do all that, okay, to bring out the full potential in the athlete. Okay. The mentor does little more than coaching. He will introduce you to people who matter. Okay. Otherwise, without mentors, I have personally gone through that. And I consider 20 years of my life were wasted because I didn't have a mentor who introduced me, who told me to present papers, who guided me to publish in reasonably good high impact journals. Not that we lacked ideas then. Send it anywhere, your choice. No, these days we would sit with the resident, with the student, and we'll say, well, you need to publish. I mean, a lot of people come and ask me, they send me, they're very excited, I saw this. I said, you must go and publish. And I suggest 2, 3, 4 journals that this is where you need to publish your paper. So you initiate them into research by publishing case reports and then big time research. That's the role of a mentor. He will connect you. You have seen so many of, the teachers here, you see them back home. So you know who is going to be your mentor. who can give you that help or assistance in moving up in the and I'm glad some of my mentors have reached the pinnacle, the height which I could never reach. They have reached much beyond that, much beyond that. Nothing could be happier than for a mentor that his mentee has gone up so high on the scale. I don't have the mentor, I don't have to create my mirror image. You know, I want to see them going up beyond a stage. And finally, these days, it is so easy. We are all connected through the internet, through the emails. I'm sure each one of you sitting in the hall has access to email. I have, for the last 30 years at least, ever since email became available, I have told my audiences, my students, write to me if you have an issue. Communicate with me. I'll help you. Nobody writes to me except some of the senior most people in this country who regularly share their passion, their concerns, their, what could be done, what should be done, and how to go about. They are the ones who are keeping my academic interest alive, Professor Atri sir. They are the ones keeping me on my toes. They send me a problem a day. Okay, how do we solve it? So the mentors, the business of mentoring is so much easier there. And nowadays you need to, you want to develop skills in surgery, a particular skill, a particular surgery, or a particular technique. You want to specialize in cornea or retina or uveitis or name it, strabismus, neuroophthalmology. There's so many fields. So a single mentor would perhaps not suffice, and you need to be seeking multiple mentors around the globe. The internet has removed all that physical obstacles. The distances have melted. Okay? So you will, if you wish to, I am not forcing excellence in you, but if you want to do well for yourself, this is my parting advice to you. Be communicative. Use all the devices in your hand. Email is the simplest. You can do that and communicate, talk, share your problems. Okay, with the people you trust, people who would help you. Thank you. Thank you, Professor.
Thank you, sir. I would now request all the dignitaries to please come forward for the felicitation ceremony. I would request Professor Atri sir to please felicitate the chief guest, Professor Amod Gupta sir. I would now request Professor Amod Gupta sir to please felicitate Professor Atri sir. I would request Professor Atri sir to please felicitate Professor Sunandan Sood sir. Now I would call upon Dr. Tanu Singh, co-organizing secretary of the event, to conclude with the vote of thanks.
I would thus like to conclude the inauguration function by extending my sincere thanks to our honorable chief guest, Professor Amod Gupta sir, for taking out his precious time and blessing us with his presence. Words are not enough to thank the constant guidance and support given by our worthy director principal, Professor A.K. Atri sir. I would also take the opportunity to extend my deep regards and hearty thanks to Professor Sudhir Garg, Medical Superintendent GMCH, and Mr. Pradyuman Singh, Additional Director Administration, for providing necessary infrastructure for organizing this function. I'm also thankful to Dr. Sunandan Sood sir and Dr. R.K. Bansal sir for sparing their valuable time. I would like to sincerely thank all the faculty members from the Department of Ophthalmology at PGI and GMCH who always support us. I'm also extremely thankful this time to the senior faculty and the other faculty members from the other departments at GMCH for investing their precious time for this PG teaching program. A big shout out to all the PG students from various colleges who have participated with such enthusiasm and fervor. I would also extend my thanks to the HODs of all the government colleges for letting their PG students participate in such huge numbers year after year. I am thankful to the engineering department, horticulture, sanitation and security. This program would not have been possible without them. We are incredibly fortunate to be supported by a team of highly motivated and dedicated students, along with the optometry staff, office and ministerial staff. I am deeply grateful for the enthusiasm, commitment and the willingness each person has shown to go above and beyond their usual roles to make this event a reality. I thank you all for making this event a successful one. I would request everyone to please stand for the national anthem.
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य